Let's bring in Dr. Yakubu Baba Mohammed, who is the Registrar of the Environmental Health Officers Registration Council of Nigeria. Very warm welcome to Newsnight.
Thank you for having me.
Cholera is spreading really fast. I mean, for the federal government to raise the alarm, it shows how terrible the situation is. But your council only registers those officers that are supposed to enforce environmental standards from the health balance and the rest. How much do they really do before we're having this kind of outbreak in 21st century Nigeria?
Thank you very much for raising this important issue. Cholera, if you look at the disease, is a disease of sanitation, and it's a disease that is also sanitation based, because the cholera virus is normally transmitted to man through injection, that is taking something, whether food, water, or contaminated soil. And it is, if you look at the history of the profession of environmental health, it started with the colonial masters when they are coming. And this will also draw the attention of Nigerians. Even London, the first cholera outbreak in London is as a result of water contamination. And in Nigeria today, why the incidence or the outbreak of cholera is keep on occurring is because of one factor, because the environmental health services are not put in the right perspective as a first preventive strategy. And that's why you see one good thing about the environmental health services, if you are getting it right, you see the indices of the disease going down. If you look at the outbreak of cholera in 2001, in 2000 and 2001, the cases, the incidence, and also the new cases is always increasing. That means we are not getting it right.
Absolutely, because I remember back in the day, we used to have a situation where the public health services, you'd had sanitary inspectors
yes,
that always made sure that people kept their environments clean. And of course, even at some point, we even introduced environmental sanitation. Then eventually, you know, we made it voluntary. And now that doesn't even happen anymore. And now the government is saying Nigerians need to play their part in terms of preventing cholera. We've lost 900 people. There is a cause for alarm. So what is the government doing to ensure at least that the right things are done?
Thank you very much. You know, the Minister of Environment, Dr. Mohammed Abubakar, who is equally a distinguished sanitarian, the first thing he did, you know, is to activate our emergency response. Then second, our sanitation desk officers in the state. But looking at the manpower gap, you know, constitutionally, environmental health services are community services. Environmental health services are local government services. But when you go to the local government, how many of these environmental health officers, how many of these sanitary inspectors are really working in the local government? And how many also have the required logistics for them to embark on what we call the sanitary inspection? The missing link is, as long as the sanitary inspectors are not going from house to enforce this legislation, let me tell you, the public health law has granted them the power and the privileges of a police officer. It's only a health officer who has right to enter into any premises without a warrant, with a reasonable hour for the purpose of inspection. But the local government is not employing them. This is one of the critical factors. And that's why even our health system is overstretched, because most of the diseases that require hospitalization today doesn't need to even go to the hospitals because are preventable. More than 70% of the diseases that are taking our patients into the hospitals are still sanitation-related diseases. And also, even the health system, after you have managed these cholera cases, you return them to the same environment where they get infected. They get reinfected and they still go back.
So how do we
it's a vicious cycle.
It's a very vicious cycle.
Very vicious cycle.
How do we bridge the gap now?
The solution is you place environmental health where it belongs. Thank God the Honorable Minister of Environment not only activating that. Did you ask yourself? Yes, NCDC is trying because they are confirming and isolating the virus from the infected person. What about the environmental media? How many samples did you take? How many samples of water did you take? How many samples of food did you take to isolate the microorganism? I want to appreciate the Honorable Minister because now he has directed myself and the Director of Pollution Control to create the first environmental and public health lab. And he has directed that we must go to all these states to get samples. Because the issue is, if you have not managed the environment, forget it. You cannot break the vicious cycle.
Absolutely.
And cholera has become endemic in Nigeria. In the 21st century, we shouldn't be having people die. But we'd have to say thank you so much, Dr. Yakubu Baba Mohammed, Registrar of the Environmental Health Officers Registration Council of Nigeria. Thank you for joining us.
Thank you for having me. Thank you.